When learning the appendicular skeleton, what we want to do is separate it into the upper appendage and the lower appendage. And you'll notice the total number of bones in the appendicular skeleton is 126. 64 of those being the two upper limbs, and then 62 of them being the two lower limbs. Now, why is there a difference? Well, there's a few things that are different. The first difference is in the girdles. So the pectoral girdle is, if we look at just one side, has a clavicle and a scapula, whereas the pelvic girdle on one side just has one hip bone. So that's one difference. Another difference is the carpals in the wrist. There's 8 of those, whereas the tarsals, there's 7. So that's a difference. And then finally, the leg has a patella at the hinge joint of the knee, whereas the elbow doesn't have such a bone. So there's minor differences, but the theme is very similar. There's a girdle, all right, and the girdle is what the limb is attached to, kind of helps attach the limb to the axial skeleton. And then we work our way down the limb, and we start with one bone that's proximal. That's going to be the humerus in the upper limb, whereas we have a femur in the lower limb. Then there's 2 bones. There's 2 bones in the forearm, and then 2 bones in the leg. And then there's carpals compared to tarsals. There's metacarpals in the hand. There's metatarsals in the foot. And then fingers and toes have phalanges. All right. So we're going to start with the bones of the upper appendage. The girdle, or known as the pectoral girdle or shoulder girdle, is made up of the clavicle or collarbone and scapula. So we'll look at those first. Then we're going to move down the appendage, or I should say we're going to move distal, right? We're going to work our way away from that attachment, learn the humerus, then the radius and the ulna, then the 8 carpals in the wrist, the 5 metacarpals in the hand, and then the 14 phalanges, which are the bones in the fingers. So let's start with the clavicle or collarbone. For the clavicle, we want to know basically what are the names of the 2 ends. So we want to be able to identify the clavicle. We should probably know that it's often referred to as the collarbone. It is fractured quite often, whether it be during a sporting activity or a car accident or a fall. That collarbone has been known to fracture quite a bit. It attaches the sternum on one end to the scapula on the other end. So one end, the medial end, closer to the midline, is known as the sternal end because it attaches to the sternum, whereas the lateral end that attaches to the scapula is known as the acromial end. And acromial comes from the fact that it attaches to the acromion of the scapula. So this structure here is known as the acromion. And acromion means high point in the shoulder. So that's kind of the highest point. If you feel your shoulder, you can feel a little bump up in your shoulder. That's the acromion, which forms a joint with the acromial end of the clavicle. And that joint has a name. It's known as the acromioclavicular or AC joint. So we're going to notice that a lot of our joints are named after what 2 structures come together and form that joint. So the 2 structures here are the acromion of the scapula and the clavicle. Okay? So that is the clavicle. The scapula's got a lot more to it. It's a little more complicated than that clavicle. But there's definitely some important structures to be aware of on the scapula. These structures are either there for muscle attachment or there for bone attachment, like the humerus, So these things are going to be very important when we get on to muscles and joints. So the first thing I want to show you here are the two views. We have the anterior surface here and the posterior surface here. They look similar, but you'll notice that in the back we have this structure here coming up and then kind of ending as the acromion. Whereas on the anterior side you see this kind of hook-like structure called the coracoid process. So you can view the acromion from both views. So you can see it here and here. So that's for the clavicle to attach to. On the anterior side, we see this coracoid process. Now that word coracoid means crow's beak. So someone looked at it and thought it looks or resembles a beak on a crow. And that crow's beak or coracoid process is for muscle attachment. There's actually 3 muscles that attach to it. The one you've probably heard of is your biceps brachii muscle. So one end of it attaches here, and then we're going to see the other end attaches to your radius. And then you also need an attachment for your humerus. So the humerus forms a ball and socket joint with the scapula. And the ball portion of the humerus is known as the head. All right, so that sits in this glenoid cavity or glenoid fossa. All right, so remember, a fossa is a shallow depression. All right, it's not a very deep socket. It's very shallow. And when we get to joints, we're going to see why that's very important. It allows us to have a lot of mobility with our humerus. So that's the glenoid cavity or fossa. We also see another fossa here. In fact, this whole surface is one big, shallow surface here, known as the subscapular fossa. And when we get to muscles, we're going to learn that one of our rotator cuff muscles is known as the subscapularis muscle because it attaches in this subscapular fossa. All right, if we move over to the posterior view, we see this noticeable spine. All right, so the spine is in the back of the scapula. That top of the spine is known as the acromion. But when you locate the spine, we want to look above it and below it. Above it is the supraspinous fossa, meaning above the spine. And then below it, there's an infraspinous fossa, below the spine. And just like the subscapular fossa, we have muscles that are named after these two. Above the spine, there's a supraspinatus muscle, and below the spine, there's an infraspinatus muscle. All right, so if you know these regions of the scapula, when we move on and learn about rotator cuff muscles, those will make much more sense. And then finally, the scapula has 2 borders. One border faces your armpit, so that's known as the axillary border. And then one border faces your vertebrae, so that's known as the vertebral border. All right, so that's the scapula, looking at it anteriorly and posteriorly. We then will move into the humerus. So I'll just remind you, here's the clavicle, there's the scapula, we can see that acromion up here, there's the coracoid process there. Since this is the anterior surface, this fossa here is the subscapularis. Here, this proximal end of the humerus is known as the head of the humerus. So it's round, it's smooth, it's the ball for the ball and socket joint. So the head of the humerus articulates or attaches to the glenoid fossa of the scapula. Okay, there's a couple areas on the humerus that I'm not really going to hold you to. They're called necks. So there's a neck here. All right, so that's in between the head and the 2 tubercles. All right, that neck there is known as the anatomical neck, And then there's another neck here known as the surgical neck. They're on your list, but again, I wouldn't worry too much about those two. They're kind of difficult to point to, so I typically don't ask you to identify those. But I definitely will ask you about these two tubercles. Now you'll notice that there is a typo. This one here is the greater tubercle. It's much larger. It also kind of projects laterally, whereas right here, this is not greater. That would be the lesser tubercle. So you're going to want to make a point to correct your PowerPoint right here, if it's incorrect. In between the tubercles, well, let's talk about what the tubercles are for. So a tubercle is a knob. Okay, so knobs typically are something that you attach to. All right, in this case, we attach muscles to the tubercles. And that way we can move this humerus, right? We got to move our humerus quite a bit. We have a lot of mobility with that humerus. So we've got some muscles that attach to the greater tubercle. We got some muscles that attach to the lesser tubercle. In between them is a little groove for a tendon. One of the tendons of your biceps sits in this little groove known as the intertubercular sulcus or groove, all right, which means in between the two tubercles. All right. If we move about midway down the humerus, there's a rough surface. Now, it's not shown very well on this drawing, but there's a rough surface right here where your deltoid muscle attaches. Your deltoid muscle is a large shoulder muscle, and it provides a lot of movement for your humerus. And in order to grab a hold of that humerus, there's a rough surface for it called the deltoid tuberosity. Okay, now we move to the distal end. So this is the distal end of the humerus. It's going to attach to your radius and ulna using condyles. Now these condyles, remember what a condyle is. It's fairly large, relatively large, smooth, and it's for attachment. All right, we're going to attach a bone to it. These two condyles, though, have specific names. The lateral one, so that would be this one here, is called the capitulum. The medial one over here is known as the trochlea. Now, where did those names come from? Capit means head. So you might have heard, the phrase decapitate, or the word decapitate. That means removing a head. Capitulum means kind of resembles a head or head-like. Now, why didn't they just call it a head? Well, we already used that word. All right, the proximal end of the humerus is where you have the head. The distal lateral end of the humerus is known as the capitulum. And that capitulum, you'll notice, is what's going to attach to the radius. So radius goes to the capitulum. Ulna attaches to the trochlea. And a trochlea is a pulley. So someone thought that resembled a pulley wheel. A pulley wheel is that wheel that has a little groove in it for a rope, and then you pull one end of the rope and the other end of the rope moves up. Well, there's a groove in this condyle right here. So it kind of resembles a pulley. But that's what trochlea means. Trochlea means pulley. But what attaches to that trochlea is the ulna. All right, so those are the two condyles, but again, they have special names. Above condyles are the epicondyles. Now, epicondyles are not for bones to attach. They're typically for muscles or ligaments to attach. And you'll notice the medial epicondyle is much larger than the lateral epicondyle. And that's because you have many more muscles attaching here than you do over here. All right? This one you can actually feel. So if you feel this bump, it's often known as your funny bone. Now, usually when you hit that, it's not very funny. It actually hurts. But what happens is you're pinching a nerve up against this medial epicondyle. The nerve is known as the ulnar nerve because it runs right along the ulna down into your pinky side of your hand. So when that nerve gets compressed, you get that shooting pain down it. And we call that, our funny bone. Okay, so that's the humerus. Let's move on to the radius and the ulna. So what do you need to know? So rule number 1, which one is lateral? So that's the radius. And which one is medial? That's the ulna. You can also see that their shapes are a little bit different. So determining who's who, the most important thing is looking at distinct shapes. The humerus has some distinct shapes. These two bones have some distinct shapes. So what we'll do is start at the proximal end. So the proximal end of the radius is known as the head. All right, now it doesn't look like the head of the humerus. It's much flatter and kind of disc shaped. And that allows it to spin. We want that head of the radius to be able to spin on the capitulum. All right, and when it spins, it can rotate over top of the ulna. So that's what happens when you turn your palms over. All right, so you can take your palm, and when you turn that palm over, all right, your radius is actually moving over top of that ulna. So that's the head of the radius. Then there's an area called the neck, and then there's a tuberosity. This is known as the radial tuberosity. Now that little rough surface has a very important function. Its function is to be an attachment site for the other end of your biceps. So we learned that the biceps at more of the proximal end attaches to the scapula. This is the distal end of the bicep. All right, so that way when you flex your elbow, all right, you're using your biceps brachii to pull on that radius. And you're pulling that radius towards your scapula, and that's known as flexion of the elbow. Okay, then we're going to move to the distal end of the radius, where there is a styloid process. That's this little point here. You'll also notice that the radius is much wider than the ulna, and that's because we've got two carpal bones that attach to that distal end of the radius. And then there's also a notch. Now it's kind of difficult to see on this drawing, but there's a little notch on the radius known as the ulnar notch, because it's a notch for the ulna to attach. Okay? There's also a radial notch up here. So the ulna has a radial notch, whereas the radius has an ulnar notch. So the notch is for the other bone to attach. All right, so let's go to the proximal end. Two really important things to identify on this proximal end. One is the trochlear notch. So that's this notch. It's a large kind of notch for attachment to the trochlea. All right, so that attaches to the humerus. Then there's a structure in the back of the ulna known as the olecranon process. So feel your elbow. So if I say, okay, touch your elbow, all right, we all kind of feel that point on the back of our elbow. That's the olecranon, all right? So the back posterior proximal end of the ulna that you used to call your elbow is the olecranon process, okay? There's another structure on your study guide known as the coronoid process. That's right here. Remember, coronoid means crown. It's kind of shaped like a crown right here. And then again, there's a radial notch right here for the radius. And then if you move all the way to the distal end, there's another little styloid process. So both the radius and the ulna have a styloid process at the distal end. And they kind of help stabilize the carpals. All right, so that brings us to the carpals. What do we need to know about the carpals? Well, there's 8 of them in each wrist. They are short bones, so they're kind of like blocks, if you will. They're kind of block-like bones. In between them, they're all little joints, so they all form kind of joints with each other. So you can have some mobility there with your wrist. 2 of them attach to the radius. So notice the distal end here of the radius and ulna. We can always tell the difference between the two, either by location, so the radius is going to be lateral, so it's going to be thumb side, ulna is medial, or pinky side, or you can see how wide they are. The radius is much wider than the ulna. And that's because these carpals attach to the radius. The ulna is just there for stability. Okay, so when learning the 8 carpals, there is a pretty decent method. All right, it's using this mnemonic down here. And I'm not a huge fan with mnemonics, but I happen to think this one works pretty well. So a mnemonic is a phrase that helps you basically memorize an order. All right, so we're trying to memorize the 8 carpals. And there has to be some method to this. And the method is you take this phrase, stop letting those people touch the cadaver's hand. And those 8 words represent the 8 carpals, okay? But you have to know the method. The method is we separate the carpals into 2 rows of 4. There's a proximal row, which comes first, and then a distal row. And then how you use the mnemonic is you move across the wrist, lateral to medial. All right, so let's use these first 4. Stop letting those people, all right, which corresponds to scaphoid, lunate, triquetrum, pisiform. We have to find the scaphoid because that's the first one, and it's lateral. So that one is going to be right here. All right, so if we're looking at the 2 rows, this is the proximal row, moving lateral to medial. Here's the distal row, moving lateral across to medial. All right, so we have scaphoid, lunate. All right, and scaphoid, that word means boat-like. Someone thought it was kind of shaped like a boat. Lunate means moon-shaped. It's kind of shaped like a crescent moon. Triquetrum actually means 3 corners. It's a 3-cornered bone. And then pisiform. And pisiform means pea-shaped, kind of like a garden pea that you might eat with, your carrots, peas and carrots. So that's the proximal row of 4. Scaphoid, lunate, triquetrum, pisiform. Scaphoid and lunate being the 2 that articulate or attach to the radius. So then we move distal, and there's trapezium. Trapezium is a geometric shape as well. So it's 4 sides with no sides being parallel. Then there's a trapezoid, 4 sides, 2 sides are parallel. Capitate, so there's that word again, that means head-shaped because it has a rounded portion to it. And then hamate, and hamate has a hook on it. There's this structure here that kind of resembles a hook type of shape. So those are your 8 carpals. All right, take them in 2 rows of 4. Once we get past those, we're into the hand. And the metacarpals, we just give numbers, Roman numerals. Roman numeral 1 is this lateral metacarpal, or thumb side. Now I remind you that these are not in the fingers, these are in your hand. This is the palm of the hand here. So we go metacarpal 1, or the first metacarpal, all the way across to the medial portion of the hand, and that's metacarpal 5, or the 5th metacarpal. Okay? Then we go into fingers, and we have phalanges. Phalanges is plural. The phalanx is singular. So we have proximal. Those are going to be these 5. There's middle. Only these 4, because your thumb doesn't have a middle. And then they all have a distal, all right, at the distal end. All right, so if you do your math, you got 3, 6, 9, 12, 14 phalanges, all right, in one hand. Okay, so that gets us to the end of the upper limb. We're going to start a new video going through the lower limb.